Next, I'd like to welcome the Honorable Deputy Minister of Health from Ghana, the Honorable Robert Joseph Mettle-Nunoo. He's a social development policy analyst with expertise in governance, communications, art, and poetry. I don't believe we've ever had a poet at a drug resistance meeting before, but probably it's high time. He's a product of the Kwame Nkrumah University of Science and Technology in Ghana and also the University of Ghana. And in his role as the Deputy Minister of Health for Ghana, he has overseen many aspects of the ministry's portfolios, including, importantly, pharmaceuticals, which is, of course, very important for managing drug resistance. He is a lecturer, research fellow, as well as, he used to be the lecturer, research fellow, as well as head of the Department of African Visual Arts, Institute of African Studies at the University of Ghana. And before moving to the Ministry of Health, he was Deputy Minister for Roads and Highways. Mr. Mettle-Nunoo is passionate about managing antimicrobials, something I've had an opportunity to see firsthand from discussions with him since last night, and to ensure their availability to improve health outcomes. It's a pleasure to welcome you, sir.
Mr. Chairman, Honorable Dr. Nabi Assad, Honorable Minister of Health of India, Professor Anyang Nyong'o, Honorable Minister of Health of Kenya, Professor David Hyman, and my brother Rama. Colleagues, I prepared two presentations. One was a PowerPoint, and the other was a prepared speech. So I'll be fluctuating between one and the other just to show you the activities of bacteria. Having said that, Mr. Chairman, I bring you warm salutations from the government of Ghana and the people of Ghana, and from His Excellency, Professor John Evans Atta Mills, the President of Ghana, who also wishes all of you fruitful deliberations at a very successful conference. When I was invited to this conference, this historic conference, I did not hesitate at all in accepting the invitation for several reasons. Bacterial infection continue to exert a huge toll on morbidity and mortality in Ghana. Secondly, the theme addresses fundamentally crucial issues of a matured and coherent way, balancing the need for access with the risk of drug resistance that can accompany unfettered, uncontrolled access to antibiotics. Quite often, scientists and policymakers speak about the risk of resistance without stressing the need for access to. After all, for a parent whose child has pneumonia, the most important consideration is whether he or she can get access to the most potent antibiotic that is able to cure the pneumonia without any adverse side effects and events. Ensuring, therefore, that we understand the issues, my presentation deals basically first with the Ghanaian situation, some key indices, some of what we know in Ghana as our situation, activities undertaken by government and the private sector to address the issue, and conclusions. So you find, for example, that what this means is that it is easier for us to advise parents and others that antibiotics should not be used for the common cold, or if you went to hospital and you were given medication and you felt better and you kept some of the medication and another member of your family immediately got sick, you don't become the doctor and say, you know, the last time I went to hospital, I was given this drug and I think it's good for you, so, you know, take it. It normally happens in many homes. In some cases also, you have a situation where we do not get rid of antibiotics that have expired properly. And we leave them on refuse dumps, which is normally the playing ground of children, and people who push drugs illegally. So they just go to the refuse dump, collect them, and recycle them. Normally, they recycle them in bags, and they go from one vehicle, commercial vehicle, to the other. In Ghana, it's very dramatic. They pray for you first, and then they identify the driver and say, you know, the last time when I was on your vehicle, you were very, very sick, and I gave you this particular drug, so you can have another one. And then they start selling expired drugs to unsuspecting people. Now, you will notice, therefore, that I'm talking about a particular country called what? Ghana. And Ghana is located somewhere in West Africa, in the ECOWAS sub-region. We have neighbors like Cote d'Ivoire, Burkina Faso, and Togo. Incidentally, they're all French-speaking countries, but they don't send us French bacteria. Now, I have here a comparison of health key indicators from the WHO statistics, and here I'm comparing the data from Ghana and the African average. So you find, for example, with children under 5 mortality rates, we have in Ghana 69 per 1,000 live births, as against 127. Immunization coverage, we are at 93%. The average of Africa is 69. Maternal mortality, we currently around 350, as against the African average of 620. Skilled deliveries by medical personnel, we are at 59%. The African average is 47. Antenatal coverage, we are at 90. The African average is 74. HIV prevalence amongst people living with HIV between the ages of 15 and 49, we are at 1.4, and the African average is 4.7. Malaria mortality rates per 100,000, we are at 48. And 94 for the African average. Life expectancy in Ghana is 60, as against 54. But Ghana is very far from meeting its MDG goals. One maternal death is not good enough. One infant death is not good enough. But are we giving our people genuine, efficacious antibiotics? My next slide deals with sensitivity tests, where we're looking at antibiotics, the effectiveness of antibiotics against Salmonella. And you'll see in this table from 1991 to the year 2010 that different types of antibiotics have had different histories. Ghana had a need to ban oral ampicillin at a certain point because it was abused in the 70s, and we now only encourage the injectables. But you can see that Cipro appears to be maybe our last chance of getting it right. And as we try to talk about drug resistance for some drugs, medical manufacturers of drugs are looking for another opportunity to introduce what? A new antibiotic. The question is it a marketing gimmick or it's real? In some cases, some of these drugs do not have the same efficacy in terms of use on children. And in Ghana, we have particular challenges with the H1N1. At a certain point in time when we had challenges with it, we had to insist that WHO assist us to get doses for children because the application of the adult dose didn't do the same thing to children. And the biggest challenge we had was with the media. The media reported some very alarming story that in some part of Accra, some school children that were given the H1N1 vaccine had collapsed and died, and then suddenly there was pandemonium. So while you're trying to solve medical health problems, you must always keep an eye on the media. They're always playing mischief. And they politicize the challenges as if when you get sick, it is one political party that made you sick. And it's another political party that will get you to get better. Other sensitivity patterns of salmonella in the Kolebu Teaching Hospital, which is one of our leading teaching hospitals, shows the same kind of trend of drug resistance. Now, what actions have we taken in Ghana? Since 1995, we've been developing standard treatment guidelines with a view to making sure that medical professionals stick to those protocols. The last edition was produced in 2010 as a way of providing evidence-based tools for decision-making in the procurement process of drugs into our Ghanaian health system. So you find, for example, that oral ampicillin, as I indicated earlier, is no more the recommended drug for use in Ghana, and we are now using more of ciprofloxacin. Infection control and prevention policies have also been launched, and I was happy to be involved in that as early as April 2011. We're looking more at the preventive issues before you start applying antibiotics. Are we washing hands enough? In this regard, we're working with the private sector. Some of the soap marketing companies like Unilever have formed partnerships with the government and with schools to promote the washing of hands. Barclays Bank in Ghana is working with us also to promote the washing of hands. Other drug manufacturers like Aventis are working with us in trying to make sure we have the right kind of malaria-treated nets and so on. But we still have challenges in that regard. We also have a major challenge with pharmacovigilance work. Our Food and Drugs Board is extremely active in working with the Pharmacy Council and the Pharmaceutical Association of Ghana and the Manufacturers Association. We encourage the public to inform us as soon as they have some suspicion that they are being forced to buy an imitation drug, a fake drug, and from time to time we carry out public destruction of some of these things that are brought into the country. We've been working with the Chinese government and I think the Indian government in doing some intelligence work. So certain types of drugs that come into the country, we sort of get some collaborative work with the internationals just to get a sense of what is coming and confirmation as to their source. We're also doing some work with the central medical stores in Ghana to look at batch production efficacy, shelf life, whether the things are being controlled and managed properly, and so on. So these are all kinds of activities that are going on in Ghana in terms of pharmacovigilance. We also have the working group that works as a partnership, and it was inaugurated in February 2011. The working group has had several meetings and has drafted many proposals to guide our policy on antimicrobial surveillance and management. Several pockets of collaborative research have also been done by the Department of Microbiology and the Netherlands government. The Ghana-Danish collaboration also of ADME is helping to build capacity in antimicrobial resistance management. Now, some elements of the ADME project are as follows: that we're looking at antibiotic drug use, monitoring and evaluation of resistance. This is very important because many of the regulatory bodies in Ghana simply are not decentralized enough, and therefore they lack the capacity to do regular monitoring. And sometimes we react too late when the problems arise. It's a Danida-sponsored project. We're working to build capacity. We believe that working with the universities and the public health institutions is very critical. And for those of you who are interested in this project, you can see the website here. We're also training some research students. 6 of them are doing their PhDs, and 3 of them are currently doing their masters. Now, This level of partnership is critical, particularly amongst academic institutions, our local and international agencies, and we believe that it is the kind of research that many other countries must follow. It's designed to ensure the rational use of all medicines, to expand access to life-saving medicines at all levels, especially for the poor and vulnerable. Now, since 1995, the Ministry of Health has been publishing periodically the National Standard Treatment Guidelines, which is evidence-based to ensure that only medicines with a strong body of evidence and efficacy and effectiveness are chosen for the administration of supply to various health institutions. We also have a national health insurance scheme, and I think that has played a very big role in controlling the abuse of antibiotics. When you prescribe antibiotics over and above your level of care, your claims are not reimbursed. So that in itself has helped to minimize the abuse of antibiotics. We have not succeeded very much in private health institutions because in some cases they are motivated by other reasons, and they are also sometimes agents of other manufacturers, and they get a commission on how many of these antibiotics they push. So I'm just raising it for your attention because in forcing the partnership, we must be looking at transparent, responsible, strategic partnership. And it's going to be very useful for us to look at that. Now, in conclusion, I want to emphasize that my presence here is a reflection of political will. The government, the recycling or reprocessing of medical consumables, it's an area that will become a challenge in the future. Some time ago, I only knew of people boiling medical equipment and then using it again. These days, they come in plastics and metal. And so we must be looking at cost saving. Sometimes proper processing, recycling to the standard of safety might be a cheaper way of providing some of these items, like pace setters that are more expensive in developing countries like my country, could be looked at as some of the possible ways of reducing infection. So I'm talking here about determination, commitment, strategic, transparent partnership, and I believe that with that concerted effort, we'll surely succeed. I thank you for your attention.